stuff is. All right. Good afternoon, everybody. Welcome to another edition of the Insights Over the Lunch Hour. It's just a kind of an update that we like to do here at the council. The executive staff like to give an update following the each of the council meetings that we have to kind of let you know what changes have been adopted in the rules, what's coming down the pipes, and then just kind of some other big ticket issue items that we see going on in the regulated field. Just give everybody a heads up. Here with us today, we've got, excuse me, so I'm Daryl Spinks. I'm the executive director of the Behavioral Health Executive Council. We've got Robert Romig. He's the deputy executive director. Patrick Hyde, the general counsel. And we've got Miss Diane Moore. She is the board administrator for the psychology board. Miss Christina DeLuna. She's the board administrator for the LPC board. And then, of course, Miss Sarah Fassholz, who is the board administrator. She pulls double duty for the MFT board and the social work board. And then we've got Tim Spear here. You can't see him. He's off camera right now. But he is the director of operations, at least for the next few days. He is. Mr. Spear has pulled the ripcord on his retirement parachute and is getting out of the business on this at the last day of the month. That'll be his last day with us here. So we roped him into doing one more insights with us. So we'll have him here with us today. Just kind of give you some little instructions on kind of what we're doing here today, what we're not doing. We're going to be talking about rules that were proposed and adopted at the last council meeting on June 25th. We're also going to be talking about just various other topics that we're aware of that are going on in the field. What we're not going to be talking about are pending applications or pending complaints. We certainly can't talk about any kind of pending complaint because that is confidential by statute. And we don't want to talk about applications because none of us here are processing your application. We couldn't tell you anything about your situation, and you probably wouldn't want to talk about it anyway over an open meeting like this. We've got almost 700 people watching today, so it's a pretty good crowd. Like I say, you'll get if you watch for the hour, you'll get 1 hour's worth of continuing education credit, which you can use for ethics. At the end of this meeting, or towards the end, we're going to save lots of time for Q&A. You guys can ask us anything you want to, even if we don't talk about it. If it's a subject that we don't talk about today, it's just kind of a free-for-all. You can ask anything you want to, and we'll do the best we can to answer it, as long as it's not about a pending application or complaint. So with that, I'm going to go ahead and get started. I'm going to start out with the proposed rules that we had at the last BHEC meeting. There were 5 of them that were proposed, and some of them are interesting. Others are just kind of mundane ministerial changes that we have to make. The first one is going to be 882.14. It's called, the rule is entitled Petition for Waiver Remediation Deficiency. This is going to be a brand new rule, and Robert's going to throw the rule up on the screen so that we can all see it and talk about it. Now, Robert, can we zoom in on that a little bit? Make it geezer font for me. There we go. This is a brand new rule. Historically, in the past, let me back up. We started developing rules to address deficiencies in applications. Really, it kind of started with BHEC. It started under the psych board, what we would call the Stanley rule. That's what we call it here at the staff level. And it's eventually grown and spread to the other boards and and now it's at the council level. But the object behind it is we obviously we can't waive or cure any kind of deficiency if there's a statutory component that you're missing in your application. But if you've got a deficiency just in an area that is where the criteria is set by rule alone and not statute, for example, you don't have a specific course and the statute doesn't require that, it's just required by rule. We're trying to develop ways that you can remediate that. And in the past, we had always kind of done it in a piecemeal fashion. So, for example, in psychology, if you had a problem with your internship, say, we had a specific rule in 463.11 that dealt with deficiencies in that area. And then, we developed rules that dealt with deficiencies in certain areas in the MFT area rules, and then in the LPC rules and social work and so on. But one of the things we learned when we brought Mr. Romig on staff was he kind of posed the question to us. He was like, why are we doing this in the piecemeal fashion? Why don't y'all just develop a global rule that will address this? And then you're not having to put a waiver or deficiency rule into each rule where a deficiency or a waiver commonly occurs, which just makes the rules longer. It makes it more complicated. You have to update numerous rules whenever you want to change that. Why don't we just do a global rule that the boards can all use to basically get the same effect? And so that seemed like a good idea. And so that's what you're seeing here before you is 882.14. It's the embodiment of the idea. We're going to create a global rule that the boards can use if they want to. They don't have to, but it exists at the council level, and it will allow the boards to waive any shortcoming or deficiency, or they can order a remediation. You don't necessarily have to waive it. The board could say, you're going to have to do X, Y, and Z to make up for that deficiency, and then we'll let you in. And so that's what this rule is intended to do. It accomplishes two things. There are some deficiencies that are caused by disasters, declared disasters. The pandemic, for example, we had a lot of people in the MFT world who were not able to meet their face-to-face hours for, I think it was direct counseling or something. They had a cap on the number of telehealth hours they could use to obtain licensure. That was something that we could waive during the pandemic, during the governor's declared disaster on that. And so we still have that ability here if there's a gubernatorial declared disaster. This rule also allows the boards to choose whether or not they want to waive or require an applicant to cure a deficiency when the deficiency arises out of a rule only. Again, we can't waive anything, or you can't do anything about a statutory requirement, because that's the legislature has said thou shalt have that requirement for a licensure. We don't have the authority to waive that. But this is going to give us the ability to waive or remediate. Now, it's not a guarantee. In other words, just because you can ask for it, and let me back up a little bit. This is also not something that we're just going to on our own do. You have to ask for it as the applicant. So don't expect staff to go, well, we'll go ahead and, we're going to waive that deficiency. You're going to have to ask for it, and you're going to have to explain why you should be entitled to it. And it can't just be because I feel like it. It's got to be for good cause. And your deficiency, if we waive it or we remediate it, it's got to be something that's not going to threaten public health or welfare. So if you've got some major gap in your training, even though that requirement may exist only in rule, chances are if not having that means you're not going to be a qualified practitioner or provider of services, chances of the board waiving that are going to be slim to none. I'm just going to tell you now. Now, they might come back and say, well, you can remediate it, but the remediation may very well be the same thing as whatever you would have originally had to get. So if you had to go get an internship, or, I mean, I'm not going to go into the full details of what could be cured or what the problems might be. The rule is meant to be flexible so that we can handle a wide variety of deficiencies, but that full spectrum is too much to talk about here and now. But I would encourage all of you to study the rule. Take a look at it. It should be published on our website, which I think Robert's going to go over later on, and kind of show you where you can go to view these rules and give public comment on them. But it's out there for you to look at. I'd really like you to take a look at it. If you got some input in it, it's going to be open for public comment. So, but that's a big one. That was a big one that happened. The next one is going to be 882.21 is going to be license statuses. So this is going to be one where, let's see. This is going to be one where we fix a major problem that we had. It deals more with stuff on the enforcement side. It's not so much, you're not going to encounter this. I hope none of you ever encounter this rule. If you encounter this rule, this means you have probably done something pretty bad, because this rule is intended to deal with individuals whose license is about to expire with a pending complaint. In the past, we have always run into the problem of if somebody's got a complaint pending and their license expires, we have lost jurisdiction over that individual, and there's nothing we can do to that individual. Uh, we don't have jurisdiction. BHEC, the boards, we don't have jurisdiction over your person. In other words, if you do something wrong, there's no psychology, there's no counseling or social work jail that we come arrest you and put you in that. The only authority we have over you is by virtue of your license hanging on your wall. In other words, the only thing we can do to you is give that license and take that license away or restrict that license. That we don't have jurisdiction over your person, your corpus, if you will. And what this is designed to do is to prevent scenarios that we have seen in the past where somebody has a pending complaint. Sometimes it's for a serious violation. Sometimes it's for, just an administrative low level violation. And yet their license expires before we can move them through the adjudicative process. It takes time to do ISCs. It takes time to do investigations. It takes a lot of time to do things over at SOA. And sometimes people will just say, you know what, I'm just going to walk away from it and let my license expire. And that happens before we could get you through, say, the revocation process to take your license. This changes that. Uh, the way we had handled it, or the way we handle it now is we have to put a modifier on your license so that if you expire with a pending complaint, we know when you reapply, we know to reopen that complaint and move forward with you. With this rule change, we will now be able to hold your license basically on life support, even if you don't want it anymore. We can keep it open long enough to finish our investigation and issue any kind of disciplinary action that is necessary following that investigation. And then we will let your license expire. It keeps people from running out the clock, is what it does. And so this cures a major gap in our enforcement system that we had before. Um, like I say, I hope none of you ever run into this, or ever, because if you run into this, it means you're in trouble with us for some reason. So hopefully this won't be anything that any of you will ever have to worry about, but it's certainly something that was needed in order to help protect the public from people who could just kind of let the clock run out on their license with a pending complaint. It also does some clarification about, that we when we were changing up the rule to account for this, we recognized that we had a problem. Um, we were saying that only an active license could practice. Well, in fact, somebody with a restricted license can also practice, and this cures that little problem now. That was a problem on paper only. It didn't really affect anybody out, any licensees or anything, but it was something we went ahead and cured while we had the rule open. So this rule has been proposed by the council. The next one is going to be 88410, the investigation of complaints. Okay, what this really does is it kind of clarifies our authority. We, you know, sometimes I know this is going to come as a shock to all of you watching, but sometimes people file complaints with us, maybe not for the right reasons, maybe just to harass a licensee or just to kind of engage in some scorched earth warfare against you. They don't like what you said about them. They don't like what your opinion was in court or what have you. And what we were finding is sometimes people will file complaints, and then when we start pressing them on the investigation about, well, explain to me why you say this, or show me, what evidence you have to back it up, all of a sudden they go silent, and you don't have any kind of cooperation from them. While we had always believed we had the authority to then um, basically shut down the investigation, dismiss the complaint when we're dealing with an uncooperative witness, it was never really spelled out in rule. And now we're basically making that very clear in rule that if you're going to file a complaint with us, you need to be willing to cooperate with us during the investigation. It not only is it it's not fair to the licensee, or I know nobody cares about fairness to staff, but it's not fair to the licensee, but it's also a waste of state resources and a waste of our time if you're just going to file something and then not follow through with that. If we need you as a witness and you don't show up or you won't return our phone calls or emails, that makes it impossible to prosecute a complaint. And so we really don't have any choice but to dismiss a complaint. And that's really what this rule change is reflecting, is that if you don't provide us with enough evidence to substantiate a violation, or you don't cooperate with us, it just makes it very clear that we can dismiss the complaint. Now, I'll tell you, typically we do not, anonymous complaints are very, very seldom lead to much of anything in terms of investigation. Because so much of what we deal with, you have to have, witnesses. You got to have somebody who has some firsthand knowledge of whatever the violation is. The only time where a non-cooperative complainant might not result in a dismissal is if the individual says, look, they've got some false advertising, or they got some extremely misleading advertising, something where there's some objectively verifiable evidence that would stand on its own, separate and apart from the complainant. That type of scenario, we could still move forward on a complaint regardless of whether the complainant cooperated or not. But those are pretty rare. That type of a scenario is fairly rare. But we run into the situations a lot where the complainants will file something and then they just abandon us, or they quit returning phone calls, or they just change their mind. They're like, I want to withdraw it, or I don't want to do it anymore. Okay. I mean, there's not much we can do in those situations whenever that happens, but dismiss. So, and this rule is just an attempt to kind of codify the reality of that situation. So that was proposed on the June 25th meeting. Next one, Robert, is going to be the witness fees. This rule, it's what we call a repeal and replace. There's an existing rule in place right now that it's there, but it's not nearly as fleshed out or as detailed as it needs to be. And what we're trying to do here is make it much more clear what the law is governing, deposition, subpoenas, and witness expenses. Again, hopefully none of you will ever have to deal with this, but this just kind of makes it a little more clear about who's going to bear the cost, kind of how those costs are calculated. You can read the rule. I'm not going to go into it. This is more, this would be stuff that Patrick could geek out on you with, I guess, if he wanted to, but it's none of you. I hope none of you will ever have to deal with it. If there's any defense attorneys watching that appear before us regularly, they're going to want to follow this or kind of see what it is. But it's really not a big game changer in anything. It just kind of fleshes out, puts a little more meat on the bones than what our current rule has, which is pretty spare, pretty sparse in my opinion. So let's move on to the last one for the proposed rules is 885.1, the fees. Typically, this is something that I feel like probably most people are always interested in. What are we charging? What is it going to cost you? And let's see, it's probably going to be.
Sorry, let me pull up the chart.
Yeah, the chart. There aren't a lot of major changes. The big change that I can remember on this one is going to be the temporary license application fee for MFTs. It's been probably a year ago or a little more than a year ago, the MFT board approved a rule for temporary licensure on MFTs. I will say this: not all the boards have authority to do temporary licenses. Psych does, MFT does, social work does, but it's not the same type of it's not a temporary license, probably how you're thinking about it. I think when most people think of a temporary license, they think of the ability to come into the state. I'm already licensed someplace else. I want to come into the state, and I got a client who's going to UT, and I need to provide some treatment to them while they're there in Texas, and then they're going to come back home and resume therapy with me. Or you want to come in as a witness, an expert witness in a case or something like that. That's typically what people think of in terms of temporary licensure. LPC, you don't really have that at all. Psych and MFT are the only ones that have what I call a true temporary licensure statute. The social work temporary license is really just meant as a bridge license. And it is so limited in its application, it's of almost no use and no value. So I'm not even going to pay a lot of attention to it. But anyway, the MFT board has authorized, or they've proposed a rule that'll be published in the Texas Register. It should be out on our website too for public comment. it operates very similarly to how the psychology temporary license does. In fact, it's built off of how psych is, except the MFT has a little bit more flexibility. MFT does not have to, the psychology, if you're going to apply for a psychologist temporary license, you have to be licensed in a jurisdiction with substantially similar licensing requirements. That component is not present in the MFT temporary license. And honestly, that's probably for the better, because that is it's a problematic component on the psychology side. I'm kind of glad it's not in the MFT rule. So, but the reason we're having to change the fee chart here is to put in the application fee for that MFT temp license. Y'all will see that. And then there's some other minor changes in here that really I mean, you can see like under the upgrade for MFT associate to MFT, we just shifted $1 from one area to the other. It's because we had it wrong. I think we had a typo or something in there. So there's just some little minor ticky-tack changes like that, but the big one is the temp license. And that's it for the proposed rules for BHEC. Now, the adopted rule is 882.20 or 0.2.
And Daryl, while this is coming up, we got a question that I wanted to answer live for everybody. Question of, are these in the Texas Register? They are on the online version, but they are officially appearing in the August 2nd Texas Register. So next Friday's publication of the Register, and they will be open for public comment for 30 days after that. They will go onto our website sometime mid next week with those links. And so you'll have 30 days from then.
Okay, I apologize, everybody. I thought we already had them on our website. Honestly, you can usually look these things up on the Texas Register before they're actually published. They actually load them usually about a week before they go out. So you could plug these rules into the Texas Register and go ahead and look at them. You just won't have the links available if you wanted to do public comment right now. You won't have those links available right now. But you could go ahead and type out your text and have it ready just to cut and paste if you wanted to get ahead of that. But this is 882.2. It was actually adopted. Now this all of you guys are probably licensed already. My guess is we don't have too many applicants out there watching. So this isn't going to affect y'all unless you apply for another license in the future. But this is kind of a big deal for us at the staff level. Historically, we've always, if you wanted to submit, say you had to provide verification of licensure, you had to go get official verification from whatever states you were licensed in. That had to be sent directly from that state to us. That is kind of an arcane and antiquated way to do business now. A lot of states are moving away from that, and they are simply saying, well, look, our website is our official verification of your licensure. If you want it, go look at it. Colorado, for example, will not even send out. They don't verify. They won't send out, I don't think, verifications for licensures from DORA, what they call DORA, and that's their kind of umbrella board, kind of their BHEC, if you will. They don't even send anything out. And there's a lot of jurisdictions that are like that now. They're just like, go look at our website. We're not going to fool with it. And what we're trying to do is capitalize on that. Number one, it's easier for staff, it's easier for the applicant, and it's a whole heck of a lot cheaper. Because if we can just punch you up on New Jersey's website and I can see, Diane Moore's a license, she's an LPC with no disciplinary history, then that's all I need. I can hit screen, I can print screen, save that into our database, and we can satisfy that requirement for licensure verification. Now, there are some things you can't do that way, like NPDB, self-query reports, criminal history stuff. You guys can't do any of that. But if we can achieve verification either directly through the government website, through a telephone call with that agency, as long as we're talking directly to whatever the agency is that's in charge of regulating you in that other jurisdiction, this allows us to rely on that, whereas historically we have not been able to do that. So it really is a big game changer for us. I know it probably doesn't mean much to y'all, but it's a big game changer for us. So and as more and more states move towards this, it will become it will operate more and more in y'all's favor, the licensees and the applicants, because it's less you have to do. and it should be cheaper for you, and it's certainly easier for us. So that's really all I have on BHEC. Like I say, it was given the fact that we are undergoing quadrennial rule review right now, which I'm not going to get into. I'm going to let Robert talk about that in a minute. We are purposefully trying to keep the number of rule changes kind of at a minimum right now, because when you're doing rule review, you don't want to be changing the rules that you're reviewing while you're doing it, because then it really throws off the math of it becomes very difficult to do, if not impossible. So I know a lot of people have complained in the past about the number of rule changes that we were making. You should see a noticeable decrease in the number of rule changes. We are trying to be very purposeful in the ones that we do make now, that they need to something that we need to get a significant benefit out of changing the rule now, and it not just be really for some ticky-tack reason, or point of convenience, if you will. It needs to be a significant benefit to you or to us at the staff level. So you're not going to see a lot of rule changes, I don't think, come down the pipe from BHEC or from the member boards for quite a while until rule review is complete, because Robert will beat us with a stick if we start making a bunch of changes, because that makes his life hell. With that, Diane, I'm going to turn it over to you for the psychology board update. It looks like you've got a massive agenda there with one rule change to talk about.
And Diane, I've shared it on the screen for you.
You're on mute also, Diane.
Diane, you're on mute.
Okay, I do
There
have a
you go.
PowerPoint. Do you see it? Can you hear me?
Yes. Yes, we can see.
Yeah, loud and clear.
You can see the PowerPoint?
Yes.
Okay, because I have other stuff popping up over it. Okay, so this will be the update for the summer 2024. We do have one rule that we're proposing to repeal. It's Rule 463.25, dealing with the health service psychologist specialty certification. This rule will appear in the Texas Register issue of August 2nd, 2024. Just briefly, the reason why we're repealing this rule, the council determined that there's no public benefit to continue to regulate this HSP specialty certification based on a HSP credential issued by the National Register. So the impact of this change is we will no longer issue the council specialty certification for HSPs, and a licensed psychologist will no longer need to show proof of a current HSP credential from the National Register when renewing an LP license. What will remain the same is the licensed psychologist can still apply for a health service psychologist credential through the National Register for Health Service Psychologists, better known as National Register, on their site. So it's a credential that's still out there and still valuable for the public. So consumers are able to find services for psychology. And that concludes the proposed rules for a psychology board. Thank you.
All right. Thanks, Diane. And just a reminder to everybody on the HSP, if you currently have the HSP, you're going to keep that. We're not taking that designation away from you. We're just not going to be issuing any more from the board, because quite frankly, we haven't issued any in I mean, it's been years since we've issued any.
Yeah.
It seemed to be primarily used for a way to bypass the oral exam back when we had the oral exam requirement at psychology. And it's honestly, it's just, we kind of feel like we're taking your money for no reason right now. It costs you $20 a year to maintain it, and it doesn't seem to get you anything. You can still put HSP behind your license. If you want to have the health service provider designation, you can do it. Just go get it from the National Register, which is what you'd have to do anyway if you were to get it from us. So it's not an extra step. You know, we're not making you do anything you wouldn't otherwise have already had to do. Just go to get that, and you can put that, you know, add that behind your license or your designation whenever you're signing things. So we're not taking anything away from you really. We're just trying to keep you from having to pay $20 a year for something that doesn't do anything, and to kind of reduce the workload on us about why are we issuing something that is useless. But we can't really see any use for it. So it's just part of some streamlining and efficiency upgrades that we're shooting for. So next up is going to be Sarah with the Marriage and Family Therapy Board rule updates. Sarah?
The first one is in 801.114 academic course content. And should I pull that up, Robert, or are you still?
I'm
You're
there.
getting
I'm
You're
getting
getting
there.
there, it's coming. Subsection D at the bottom of that is being removed to better align with the statutory authority. But part of that, it's not that the door has slammed shut completely for those who have a deficiency in their pre-graduate internship. As Daryl explained with his first rule, there's a proposal then for a global remedy, if you will, that you can ask for some remedy for your deficiency or some waiver. In the next rule, 801.115, academic requirements and supervised clinical internship equivalency for applicants currently licensed as an LMFT in another jurisdiction. This rule was also this rule is being repealed entirely, this section, again, to better align with the occupations code with the statute. And again, if staff is not able to issue a license, because these provisions are removed, we still have that remedy process that Daryl explained at the top of the hour. In 801.142, it looks like a lot of things have changed, but I just wanted to bring to your attention that there's still a requirement. This is supervised clinical experience requirements and conditions. The associate is still required to get 3,000 total hours over a period of 24 months, with at least 1,500 of those hours being direct clinical services. And of the 1,500 hours, at least 500 must still be direct clinical services to couples or families. And of the total 3,200 hours must be supervisory sessions, of which 100 must be individual supervisory sessions. So we reorganized some things at the top of the rule, but those requirements are still in place. In subsection 3, B as in boy, supervision may be provided in person or by live video, or if the supervisor determines that in-person or live video supervision is not accessible, it may be provided by telephone. So this is a change in that there's no longer a specified amount of hours that provide a cap for telephone supervisory sessions, but now it's in the discretion of the supervisor to provide by telephone. And in subsection 4, we generically call this the excess practicum award, which exceeded the authority that was granted by statute. So we are setting a kind of an end date, or a sunset date for this type of crediting hours that were in excess of the academic requirement during the graduate internship or the graduate practicum. However, statute does allow us to award hours that may have been supervisory sessions during that practicum experience. So we still get to keep that part. So again, just trying to align better with statute. And then in subsection 9, that too provided some streamlining for those coming from another state, which exceeded the statutory authority, so that's being repealed. But again, the first one that Daryl talked about, there's still a pathway for some remedy of that deficiency. It's just going to be a little bit more of a process. So that concludes 881.142. And Daryl already spoke a little bit about the temporary license for a person who has an independent license in another state and their client is traveling in Texas or recently moved to Texas. One scenario is a student who's in Texas for a semester or is in Texas during a summer break. That non-Texas licensee can now get a temporary license that allows up to 30 days within 1 year from the date of issuance for them to provide services for continuity of care or transitional type of services. So that's being proposed. We welcome your comments on that proposal. And that concludes the proposed rules for marriage and family therapy. And I understand that there aren't any rules for professional counselors. Should I just go on with social work?
Yeah, Sarah, I want to add one thing on the temporary license. You
Okay.
know, that is a rule that the LMFT board had proposed. Like I said, it was about a year or so ago. It's been a long time. And people may be wondering, well, how come it's just now being proposed at the council level? It's because we're under a database configuration freeze. And back when it was proposed, we were also undergoing legislative session, honestly, just trying to get some of the things the legislature wants us to do. There's only so much bandwidth we can handle as far as changes in the database. So whenever you add a new license, like a temporary license, your database folks have to go in and change it. So if anybody, just in case anybody was wondering, well, how come did you forget about it? No, we didn't forget about it, but we have to do things in a certain order, and we're sometimes subject to the, sometimes we're subject to the availability of the database and the database staff to make those types of changes. And quite frankly, it's just taking this long to get there. One of the downsides to being an agency who uses a shared regulatory database like we do, we share our database with like plumbing board, optometry. There's several other chiropractic board. There's several other boards that use our database system. When one agency has to make an upgrade or a change, you go through what's called a configuration freeze, where you can't make any changes to that database while that agency's upgrades or changes are made. So that's the reason why it's taken us this long to get the MFT rule for temporary licensure actually proposed. Yeah, Sarah, go ahead, and since there are no LPC rules, Christina got the pass card for today. She didn't have to do anything. Go ahead and take over the social work rules, Sarah.
So for social work, the proposed rule is 781.302 in the practice of social work. This too looks like what we're mostly trying to do is to clarify the scope of practice. There's no change. A person who has a baccalaureate social work license may not practice independently. A person who has the master's social work license may not practice independently. So at the top of that rule change, we're just clarifying what's occurred there. At the bottom under H, so this used to, what we're repealing is the language that a bachelor's or a master's social worker may not provide independent practice from a location that he or she owns or leases, and that is not owned or leased by an employer or other legal entity with responsibility for the client. As the practices have changed, as the as the internet and web-based services have become more prevalent, we've gotten more inquiries about, can I work from home, which seem to be in direct conflict with H. In the case of this scenario, for example, the LMSW is working from home, but is employed by someone who has responsibility for the client. So we're just trying to clean up that language to adjust to the changing circumstances of the work environment. Robert, did I miss anything on that?
Nope, that's exactly right.
Careful read of those new rules, and that concludes the proposals for the social work board. And just for those who are doing some Q&As, or who are putting in questions, again, these are proposed rules. They are not adopted. They are proposals. So they're, keep that in mind.
Thank you, Sarah. All right, the next up, kind of on our agenda of things we want to cover today is Robert's going to give you all an update on the quadrennial rule review, where we are, where we're going. So Robert, take it away.
Absolutely. So for those of you who missed the last one of these, every agency is required to do a rule review of all of its rules every 4 years. That's called a 4-year rule review or quadrennial rule review. And what we're generally looking for is any sort of statutory problems, things like what led to these MFT rule proposals, where maybe the language of our rules have just gone a little bit farther than statute really allows, or there's been some conflict that's occurred, or life just changes. And, we've all gone through a pandemic and we now use virtual meetings. And so we just need to update our language to account for changes in how we all practice. The process we are using is all spring, we as staff have been looking through the rules and coming up with what we think are the list, a sort of combined list of all the potential areas that need attention. We have then presented those at each of the board's last meetings to get their input. In the May-June timeframe, we got the rules committees to meet, and we got the boards to meet. And we now have sort of our initial list of findings in the rule review. And what this is just a starting point. We are interested in getting all of your feedback about both the rules we've identified as potentially needing updating and anything that you think needs updating. So for example, I've seen in the questions there were some discussion about the CE rules that we have, and the recent update, no longer very recent, but that 50% of your continuing education credits must come from one of the approved list of providers. If you have concerns about that rule or have experiences of how it has been implemented and think that that needs attention, we want to hear about it. So how can you give us feedback? Well, in starting tomorrow, actually, and going for the next several weeks, we are hosting some town hall meetings to solicit input on each of the respective boards. And so let me navigate to our website where you can see under each of the board's website. So I'll just take marriage and family therapy first. Under the meeting dates and agendas tab, menu item on the far right, you will see the upcoming town hall for quadrennial rule review. And so that one starts tomorrow at 11 o'clock. In the announcement, you will see the virtual link. We will be hosting it by Zoom. We certainly have a room available here at the office, and it's in the notice if you prefer to come in person, but it's mostly designed like this webinar as a Zoom meeting for you to give input. So you can find all those details in the announcement, and then underneath you will also see this initial staff's finding tab, and that will be for each of the boards, and that will list for you the specific rules we have identified as potentially needing needing update, either by repeal or just needing some attention. So if you would like and are interested, we welcome you to any of the town halls. Again, tomorrow, July 6th, will be MFT. 1 week from tomorrow, August 2nd, will be the Social Work Board Town Hall. The next Tuesday, August 6th, will be the Psychology Board Town Hall. And the week after that, Tuesday, August 13th, will be the LPC Town Hall. And so again, all of these you will find in the meeting tabs of our website. Now, you're already coming to this virtual meeting. Maybe you're sick of virtual meetings and you don't want to come to anymore. Well, never fear. If you go to our main webpage, the homepage, and over here on the right, the proposed rule changes rulemaking process. You come to this webpage. This will incidentally be where all of the proposed rules, if you scroll down, you'll see proposed rule changes open for public comment. Next week, this will no longer say there are no rule proposals. It will list out all of the rules that you may comment on. But right above it, you will see this quadrennial rule review notation and this bolded comment form that you may submit any comments and as many times as you like, comments about rules that you think need updating. And so please take advantage of that. We will then, if I go back to our schedule, we will then take all of this feedback and present our final rule review findings and proposals to each board at their September meeting and then the council meeting in October. Now, very important, all of this work and the final findings that we propose to the board will simply be our effort to identify the work we need to do going forward. Every rule change, whether it's a repeal or an update, must still go through the normal process of posting on the Texas Register and having public comment and consideration for adoption. And so at that council meeting in October, there will be some rule repeal changes that we think are the most important and pressing that we need to get done quickly. And so we'll go ahead and propose those. But even those will still be open for 30 days for public comment, just like the rule proposals we've discussed today. And so all of this is really developing a work plan for us to work through our rules going forward. So long and short, that is the effort that will lead to sort of closing out the rule review process at January, February timeframe. Certainly, if you have questions, feel free to put them in the question link and I'll try to answer as best I can. But big effort on behalf of all the staff and the boards. They've really been putting in the hours to work through the rules and try to update things to have the clearest language and most modern approaches to the rules for you as possible.
Robert, there's a question. The town halls that begin tomorrow only review the rules that you have identified for review, not any rules counselors or the public may have submitted. Is that right? Or can you address that?
No, that is not correct. The town halls are an open forum. And so we will certainly be available to answer questions about our initial findings list, but please bring your ideas for rules that are not on the list, and so that we can get them on the list. So it is not going to be a meeting where we discuss the exact language changes that need to happen. This is just an opportunity to identify the ideas that need to be addressed. And then later we will work through drafting language and proposing that for your public comment.
Thank you.
All right, thanks, Robert. The next item we're going to tackle on the agenda is going to be, I want to speak to the EPPP issue that has been bubbling now for quite some time in the psychology community. So apologize for the other professions having to listen through this, but maybe something you want to keep an eye on in case it ever bubbled up in yours. Okay, EPPP. For years, the EPPP is the examination that all psychologists and licensed psychological associates have to take in order to achieve licensure here in Texas. It is the only exam that exists for psychologists and psych associates. I think in the world. I'm not aware of another exam that's used for psychology in the world. I know it's the only exam available in North America. And for decades, since the late 60s, early 70s, it has existed as a single exam, the knowledge exam, what we call the EPPP. Well, about 2017, 2018, ASPPB, which is the Association of State and Provincial Psychology Boards, developed a skills exam to, in addition to the knowledge exam, which is, again, like I said, historically been what we have used. And they have recently, when it first came out, it was optional. States could choose whether or not to adopt or require their applicants to sit for the, what we call Part 2, the skills exam. But now, effective in 2022, ASPPB has said, as of January 1st, 2026, all states must require their applicants to adopt or to undergo both Parts 1 and 2. In other words, you got to pass both Parts 1 and 2 of the EPPP. Now, that's a problem. That has been a problem for us in Texas because Part 2, there's no evidence of a need for that exam. Now, let me stop right here for a second. There has been a big myth, just a dirty lie that's been circulated, it seems like, amongst the communities, psychology community, that the discussions around the EPPP are that we are going to move away from the EPPP, that we're going to do away with the EPPP. None of that is true. I'm just going to say that unequivocally right now. The board, the council, they are not looking to do away with the EPPP. They are not looking to stop using it and go without an exam or anything like that. We are in discussions. We have started discussions, and we are going to be exploring through the budgeting process whether or not we want to develop an alternative exam. But there has never been a position taken. The board has never voted, and the council has never voted to do away with the EPPP or say that we're going to stop using it. So I don't know who's saying that out there, but you need to stop saying that, because that is not the case. That no such vote, no such position has ever been taken on that. So where are we at on this? What is going on with the EPPP? What we are doing is, because the council is in a position of reviewing rules that come up from the member boards to see, do these rules impose a barrier, an additional barrier on a profession? And if they do, is there a good reason for that? And obviously, if the psychology board were to adopt the EPPP Part 2, or the second part of this exam, that's going to be an additional barrier. So you'd have to pass Part 1, and then those who manage to pass Part 1, they would then have to go sit for Part 2. Now, unfortunately, Part 2, from what we can tell so far, has a pretty high failure rate. It's ranges anywhere from 30 to 40% failure rate is what it's looking like. And now that's based off a very limited data set, because not many people are using it, but that's still a high failure rate. And we used to have a skills exam here in Texas, the oral exam. And when we did away with that exam, we didn't notice, we haven't gotten a large increase in the number of complaints on psychologists or LPAs, saying, hey, you got a competency problem. You got a bunch of incompetent providers out there who are harming the public. There's when ASPPB mandated that we adopt the Part 2, they did it without any kind of rationale or reason for why it's needed. They just said, you have to do it. And their claim is they want us to move more like the medical profession, and that it's needed to ensure competency. But the problem is there's no data to support that claim. And so the board is really struggling with, why are we doing this? How can we do it? And then the council is certainly struggling with that as well, because one of its jobs is to ensure that no unnecessary burdens or barriers are placed on applicants without a substantial justification. And that's something that we don't see in any of there just hasn't been any evidence presented that there is a need for the Part 2. So, right now, Texas still requires the EPPP Part 1. I don't see that ever changing. We are planning on asking the legislature for the funding and authority to develop our own licensing exam, but it will simply be an alternative licensing exam. It will not be something that we say you have to take this one and you can't take the EPPP. What I think the board is going to do, and what I'm certainly going to recommend to the board, is that we accept either one. And that's been something that's been my understanding in my discussions with the board members, that it's just going to be, we'll take either one. You know, if ASPPB wants to mandate that you have to pass parts 1 and 2, and the legislature says, well, we don't want folks to necessarily have to take part 2, so we'll let you develop an alternative exam. When you apply in Texas, if you've already taken parts 1 and 2, or you've taken part 1 elsewhere, we'll accept that. You don't have to take the Texas exam. But if you don't want to take either one of those exams, you can take our exam, and then we would license you. So the only reason I'm mentioning a lot of this is I want to dispel this rumor that seems to be floating around out there that we are somehow going to move away from the EPPP. That's just flat out not true. And yeah, I don't know what more to say about that. I guess what I would ask people is, when you hear people say that, ask them, point you to in the record where that was stated by the board or the council, because they're not going to be able to do that. And I, you know, kind of hold people's feet to the fire so that maybe we can stop some of these rumors that are circulating. Now, are we going to for sure be developing an alternative to the EPPP? No. I mean, that's going to be up to the legislature to decide whether or not we get the funding and the authority to move forward with that. If the legislature says, well, look, we don't like the idea of folks having to sit for the part 2 because it's going to cut down on the number of folks that you can license, but we don't want to go through the hassle and the expense of developing an alternative exam, so just suck it up and deal with it, then that's what we're going to have to do. But that's something that really the legislature ought to decide on this, because if we are deciding it, if we're just deciding that at the agency level, we've got some potential liability under that North Carolina case. And I know a lot of you, if you've hung around me for more than 5 minutes, you've heard me talk about the North Carolina Dental Board case, and how it's important that member boards who are dominated or who have a controlling number of market participants, i.e. licensees on that board, they are required to have active state supervision, which is what the council provides. And it's the council's job to make sure that whatever rules, requirements, whether it be an additional exam, you know, have a substantial justification. In other words, the squeeze has to, you know, be worth the juice that you're going to get out of it before you can do it. So we have worked with ASPPB till we're blue in the face, trying to negotiate some sort of compromise on this, so that we could continue using the EPPP. We wouldn't have to develop our own exam, or we wouldn't even have to go try to develop it, ask for the money to develop it. But all of that has ended, you know, in nothing. It's all been for naught. We have not been successful in that so far. The council has filed a complaint with the Federal Trade Commission over ASPPB's mandated use of the part 2 in addition to part 1. I am hopeful that we will still be able to reach some sort of an agreement with ASPPB, whereby they say, look, you guys can continue to use part 1, and it will be, you know, optional if you use part 2. If that would occur, this whole mess goes away very quickly. We don't even need to then go ask the legislature for the funding or the authority to try and develop an alternative exam, because I don't want to reinvent the wheel. You know, we've already got part 1. We've already got a good exam. I don't want to mess with that, have to do another one. But if ASPPB continues to hold true to their position of you gotta require both of your applicants, we're not going to be helping the workforce shortage in Texas if we add an additional exam with such a high failure rate. That is just not going to be good for the citizenry. I don't see how that's going to be good for the profession. And that is just not something that I don't think the council is willing to do that without some legislative buy-in. And so that's another reason why we're going to the legislature and making sure they understand that if we don't, you know, if we're forced into this, here's going to be the possible consequence of it. You're going to have fewer providers, you know, and they just built all these nice new shiny state hospitals, and they already can't fill the beds. Well, it's going to become even more difficult to fill those beds as we tighten down the spigot on the number of providers coming into the profession. So, you know, a lot of this, the workforce shortage, a lot of this is weighing heavily on us in our decision about how to proceed here. But what I want to drive home is that no one is saying that we're going to abandon the EPPP Part 1. We want to continue to use that. We want to continue to accept that. Even if we develop our own exam as an alternative exam, I think the council and I think the board is going to continue to accept. I haven't heard anything from them that would make me think they would not accept either exam here in Texas. So just kind of everybody take a moment, chill out and breathe, because I don't think the situation is what the rumor mill paints it out to be in this regard. Robert, have I missed anything on the EPPP?
No, I think that's right. And especially just making sure everybody understands that this is a multi-pronged approach that we are really tackling with all intentionality. And you said it, but I'll say it again, that we are absolutely wanting and preferencing for the status quo to be maintained. And it's really ASPPB that has put everyone in this position by forcing this question. And so we are going to try multiple approaches to resolve this as best we can.
Yeah, and I you know, that's Robert just brought up something good. I will say this: none of us, staff, the council, the board, I know I can speak for everybody. None of us want to be here in this position. None of us put us in this position. This was nothing that the psychology board did. This was nothing that the council did. None of your elected officials put us in this position. This was the ASPPB board's decision to require this mandate. We are now having to react to that, but none of us want to be here. But we are trying to chart the best way out of this quagmire that protects, you know, our ability to get providers into the pipeline and meet the behavioral and mental health needs of this state. We are already behind on that. I mean, the workforce shortage is well known. It's well acknowledged. Nobody can deny that. And we are trying to chart a course through this mess that has been imposed upon us that allows us to continue to at least maintain the status quo and not lose ground. Our biggest fear is that that this is going to exacerbate the workforce shortage. And a lot of people, I'm noticing the comments, it's going to have a very different effect, you know, on folks of different demographic groups. And that is something that the board is very well aware of. And so we're sensitive to that, not only just on the grand scheme of things, but it's going to impact the different demographic groups in Texas differently. So we are aware of that, and we are sensitive to that and trying to take that into account. But this was not a decision that any of us made or want. We are just having to react to it. And, you know, to anybody that says, well, it can't be done, you're wrong. I mean, we could do this. I'm going to just say right now, we're not going to agree if you say, well, you can't do this, it's too hard or too expensive. I'm not going to say it's easy. It's absolutely going to be hard. I'm not going to say it's going to be cheap. It will not be cheap. But if you can build the EPPP, somebody can build an alternative to the EPPP. And we just so happen to regulate the one profession that is really good. They're the experts in building tests. I mean, if I were going to have to be in a profession to build an exam, we're regulating the very best professions to be able to do that. So, you know, we have the best and the brightest, if you will, at our fingertips through our licensee population. So I will also say this. I know there's a lot of concerns about reciprocity, how it would impact reciprocity. The exam will not be built. If we move forward with an alternative exam, we're not going to move forward with an exam that would only be palatable to Texas. We would certainly want to take into account build the exam so that, and try to include other jurisdictions in building that exam so that it may be something that they want to adopt as an alternative exam. Other states that we just in our discussions have expressed some interest in that. And so we are very aware of that. And we want to make sure that we're not building something that only we would want to use so that we can hopefully address that reciprocity concern that a lot of people have. That's a legitimate concern. I'm not going to deny that. But, you know, we're having to play the cards we're dealt here. Unfortunately, it's not the greatest hand, but we're having to play it, and we're trying to do the best we can on that. So that's really all I have to say on that, unless Robert or Patrick, you got anything you want to add to it? Update on the selection of the vendor. The next item I want to kind of bring up is if anybody was watching the June 25th BHAC meeting, you know that we have selected to move forward with using CE Broker as our online continuing education management software provider. So right now, we plan to go live on this September 1st of next year for sure. We should be live, barring some, you know, a meteor hitting or something like that. We should go live September next year. But we are right now we're trying to work out, if any of you have ever viewed a government contract, you know it's horrible. It's just not an easy thing to draft. So we're actually in the contracting phase right now with CE Broker, where we're going to draft the contract, both sides make sure that the provisions and terms contain what they need to and say what they need to. And then we'll actually start to move forward with building it. So nothing you need to do right now other than to know that at some point in the future, you will be required to report all your continuing education hours through the CE Broker portal system, which you can upload. You can find continuing education through that. You can upload everything. It will store everything there for you. It should automate a lot of the process. It should make it easy, make your life easier and simpler, because everything can be housed and tracked in one location, especially if you're licensed in multiple states, or you have multiple licenses. It will make life easier. Now, a lot of people are probably asking, well, what's this going to cost? It's not going to cost you anything. They have a free account, and the free account will do everything that's required. So you're not going to have to pay anything if you don't want to. Now, they do have upgrades where they have like concierge level programs where they'll go out and find stuff, get you signed up and all that fun stuff. But that's going to be up to you. If you want to do that, knock yourself out, more power to you. But we don't require that. That is part of the agreement with them. They have to offer a free account that meets all of our rule requirements. So you're not going to get, you know, painted into a corner there where you have to, like buying a car. If you want a radio, you got to buy a $5,000 convenience package. We're not going to do that to you. So just kind of be on the lookout for that. We'll, you know, once we get a little bit closer to the launch of that, we're going to start doing, we're going to have some outreach and education efforts to get you familiar with the platform, so that you can start logging in and using it and get familiar with it, so that you'll be able to give it a test run before you're actually required to comply with it. But we're just not there yet. We're still in the setting it up phase. Again, this is one of those config freeze things that I talked about earlier. We got some configuration freezes that are holding things up right now. The next item is our exceptional items for the kind of what we're going to be doing in our budget request. I'm not going to spend a lot of time on this because I want to get some time for some Q&A. I can see our number of attendees are dropping. We're over the lunch hour now, but basically we're going to be asking for 5 or 6 things in the LAR. The first and foremost is going to be money to do the alternative exam to the EPPP. We've talked about that already. 2, we're going to be asking for money to do some targeted staff salary increases for the folks, basically the lowest paid individuals in the agencies, the ones that we are at risk the most of losing to other agencies. 3, we're going to be asking for some funding to fill some vacant positions. I had to as people left for better paying jobs in the last biennium, we took and we cannibalized the salaries from those positions to pay others so that they wouldn't follow suit and leave. So we were going to be asking for money back for those positions. We're also going to be asking for funding to do NPDB, what we call a continuous query, so that, you know, we're supposed to be conducting NPDB query reports on all of you in connection with renewals, which is something we're going to have to start doing once CE Broker really goes live. We're kind of doing it now, but it's kind of a half-hearted. We're not fully compliant with the statute. We need to get fully compliant. So we're going to ask the legislature for the funding to do that. And then we're also asking for one-time funding to replace laptops. The agency's now moving into its 5th year of existence, and we're still operating off the laptops we bought in like 2019. Stuff's starting to break and fail. And so it's time to start replacing a lot of that equipment. So Those are going to be, it's 4 or 5 big asks. It may dwindle down to 4 or 5 requests in the LR, but I just wanted to kind of give you guys a brief overview of the exceptional items. Exceptional items are what we ask for over and above what our baseline budget is, just kind of what it takes to cover the day-to-day operations, any extra money we'd be asking for. So those are going to be the additional, the exceptional items, the additional funding we're asking for. Just because you ask for it doesn't mean you get it. It's up to the legislature to decide what you get, what you don't get. How they decide that is way above my pay grade. I couldn't tell you. I don't know how that's decided, but now you know what we're going to be asking for. For psychology, you guys, we've got reciprocity with Oklahoma now. We had it once before, but we lost it. But now we have it again. We have signed a new reciprocity agreement with Oklahoma. I saw in the comments where a lot of people were asking about why can we not get reciprocity for like LPCs or social workers? Because y'all don't have statutory authority for it. That's the not to sound blunt or rude, but psychology is the only board with the ability to enter into a reciprocity agreement with another state. You got to have special statutory authority to do it, and they have it. So that's why we're doing it for them. I will tell you, it's very difficult to achieve reciprocity with another jurisdiction. I tend to focus mainly on our neighbors around us. But like New Mexico, for example, I can't even do it in psych for them because they don't have authority to enter into it. I've tried with Louisiana, but because Louisiana requires an oral exam and we don't, they don't consider us to be substantially equivalent, even though I would. So can't get it with them. And Arkansas, I've just struggled with getting in contact with Arkansas. But that's something that's still that's still a possibility with Arkansas. So anyway, just in case you're wondering, if you're an LPC, an MFT, or a social worker, you don't have the authority to do it like psychology does. So if that's something you want, y'all need to contact your legislature and let them know. Ask them for that authority, and they're the ones that can, file the bill and make it happen. We can't do that. It would take an act of the legislature. The last thing I want to talk to you about, and then we'll open this up for Q&A, is we're going to be, Robert, Patrick, and like I say, I would include Tim, but Tim's jumping ship on us at the end of this month. He's going to go retire and whatever he does on the weekends and goof off and that kind of thing. We're going to be starting something called a leadership listening hour, and the first one is going to be on August 23rd. It's going to be a little different from what we're doing here in that it's just going to be a listening session. We're just going to open it up, very informal, very conversational. You guys can ask us anything you want to, except about pending applications and pending complaints. I don't want to talk to y'all about that. But other than that, it's free reign. If you want to ask us practice related question, don't know that we can answer it, we can certainly try. Anything to do with informed consent, record keeping, whatever. We'll try to answer it. If we don't know, we'll try to find out, or we'll just tell you that, it's beyond our ability to say. But we just want to try to put ourselves out there so that you guys can get to know us. You got a direct line of communication to the executive staff, and so that we're not just some nameless, named or faceless bureaucrat that you only see in these types of scenarios or during the meetings. We want you to be able to talk to us, and quite frankly, if you want to gripe at us, that's fair too. I get called lots of names often. It doesn't, that's just part of that's part of the business. So that's fair if you got a gripe. It doesn't have to be a buddy hour. If you need to gripe at us, that's fair too. So just make, that the invitation for that should be going out after this. I had it scheduled to go out after this so it wouldn't cause confusion about what you were signing up for. But it's not going to be updates. It's just going to be very conversational. All right, with that, I want to turn it over to Q&A. We've got about 600 people still in attendance. We had 800 and something at one point, or close to 900. I recognize we're way over the lunch hour. One other thing, in order to receive your CE, proof of your CE, it'll be an email is what you get, not really a certificate, but an email from me. Make sure you mark us as a safe sender. Just mark like at bhec.texas.gov, bhec.texas.gov. Put that as a safe sender in your email system so that the email from me will go through. I'll send it from a do not reply email address, but it'll be do not reply at bhec.texas.gov. And the reason I do that is I don't want 1,500 vacation announcements bounce backs into my own email address. So Just make sure you mark that so that we make sure it doesn't end up in your spam or it doesn't get filtered out by your system. And that'll help, because I noticed a lot of people were like, I didn't get my email from the last time. And I'm like, well, number one, I look to see, have you been here at least 50 minutes during the presentation? Because if you haven't, you won't get it. Even if it's 49, I cut it off. You got to be here at least 50 minutes. And then you want to make sure you mark it as being as a safe sender at bhec.texas.gov. And we will, let's open it up for Q&A now. So if you got a question, raise your hand, and then if we don't have any hands raised, I'll check with the callers. I'll have to unmute them individually, but let's do raise hand right now. If you got a gripe, got a question, whatever, raise your hand.
And just so you know, Daryl, just give kudos to everybody we've been answering we've had about 95 questions already in the Q&A chat column. So good job, everybody, for us bringing your questions.
Yeah, and I will apologize. I know I'm typing so fast usually in those responses. You can't look. I admit to being dumb. So if you want to hold my spelling mistakes against me, that's fine. For whatever that gets you, fine. If you want to hold that over me, I don't care. But I know I'm going to make spelling and syntax errors, and I'm trying to type these responses because they're coming in pretty fast. Whenever it's like drinking from a fire hose here, trying to answer all these questions. Miss Porsche, you got a question?
Yes, can you hear me?
Yes, ma'am.
So what do we have to do to get credit for being in attendance? I wasn't aware that we could.
What I'll do is I'll run a report. It's called an attendee report after this is over, and it will tell me who all was in attendance for 50 minutes or more. And then I just capture your email address and send you an email saying, hey, you get credit for an hour's worth of ethics. And then you just keep that email and use it as proof.
So I would like to say that you guys kept going in and out. I took screenshots of the spiraling screen. I forgot what that's called when it's trying to come back. So it did break up a couple of times and I kept coming back. So I don't know if that matters.
Okay. All right.
Yeah.
I'll write your name down and we'll see. We'll make sure. Okay.
Okay. Thank you so much.
You bet.
Okay.
Daryl, one question we have, and I just don't know, so I'm going to ask you live, is will this meeting, I know it's being recorded, will this be on our YouTube page? And is there a transcript that comes with that?
Yeah, it will be on the YouTube page. We don't generate a transcript here in Zoom, but YouTube does generate a transcript. That I have found that the YouTube transcript is actually a little bit better than what Zoom does if we turn it on in Zoom. But yeah, we'll upload it probably today to the YouTube channel, and it'll be under the BHEC playlist since this is a BHEC executive staff. The insights over the lunch hour, like for the LPC board or MFT board, we place them under their respective channel on the YouTube channel. Ms. Jackson, do you have a comment or question?
Hi, yes, I do. I am a psychologist based here in Texas, and I saw the question about AI and I asked a question. I actually also chair the Mental Health Technology Advisory Committee for APA, and I'm concerned and questioning if Texas is thinking about like technology, not just AI, but if they've kind of convened a committee or are willing to consider a committee to start thinking about how we start thinking about technology and mental health. Because there's a lot of things being built without us. Digital therapeutics just got approved or they're in the proposed CMS for reimbursement. Like all of these things are happening. And I don't see much happening at the state level. And I'm curious, like what you all are thinking about if you've started talking to people and how you all are going to support the clinicians in Texas with technology.
There has been some discussion amongst just individual board members. I don't think it's in, like, I haven't heard them talk about it in meetings really all that much. We haven't, the short answer to your question is no, we don't have any kind of committees. We don't have any kind of coordinated effort undergoing, and we're not even really thinking about, there's nothing being contemplated right now about how to address that. So the short answer to your question is nothing right now. That's something that, I mean, admittedly, we probably need to. There's just what you will see if you you ever serve on one of these boards or, you work for an agency like this, you'll see you have a bandwidth problem of just the problems in the world that you have to address. It just hasn't made it into the, I guess what you would call within our bandwidth, the capability right now. Like what do you have in mind? What would you like to see us do?
I would love to be able to see, starting to think about how this influences our policies and regulations. I think, and I can only speak as a psychologist, but even things like the digital therapeutics, how does that, when people start thinking about how does that influence when you're referring a client? So I saw someone had a question about referral. If you refer and you're referring someone to use a digital therapeutic, thinking about responsibility, like I think these are things that are going to come up, and there's a lot of gray area. Even when you think about AI and note taking, it's not just HIPAA. Now you're thinking about FTC. The FDA will probably start looking at regulations. And so I just think state-wise, we need to start thinking about it, because at some point it will influence kind of our policies and regulations, and we might have less say in that. So I think that there needs to be some sort of putting it on the council's radar. There needs to be some sort of, even if it's not a committee, even thinking about that as you're thinking about new regulations and policies, so we're not behind, because that will impact clinicians moving forward.
Yeah, we can certainly bring that to the boards, bring that as an issue. I would say, from a very practical standpoint, I would say I think the professions probably ought to be taking a look at this as well. You don't necessarily need to wait on us in order to develop and say, okay, we think this is the right policy move to make. I wouldn't wait on us. If you as the profession feel like you've got a good idea for a rule, go ahead and put something together and then bring that to us, rather than maybe necessarily waiting on us to develop it. Because sometimes it helps if you guys hand us something that we can jump off of. If you're waiting on us to build something from the ground up, that's usually one of the slower approaches, just from a very practical standpoint. But if you've got something in mind, build a model rule, a model regulation of what you think needs to be in place, and then bring that to us so that we can actually start a discussion around that. That goes for all the professions, not just psychology. I would really encourage y'all to kind of take that approach, because it really does help if we have a starting point.
And Daryl, I will say that not this exact topic, but the issue of telepractice has come up through the rule review process. And certainly it will be, I think the initial thing that has made our list that we need to look at is the regulatory side of that question, and what are the minimum regulatory safe practices that are necessary, but particularly also just making sure our language is up to date to allow for virtual practices that used to be in person. And so I think, to Daryl's point, we've identified this topic. We are probably on square 1 and 2 and 3 of getting some of the minimum regulatory standards in place. And I think what you're addressing is really more of the best practices and the actual implementation in the practice of using these tools. But so, yeah, certainly second what Daryl says about, if you have ideas of rule language, please, we never object to using other people's ideas.
Yeah. All right.
I will also note, before we get to the next question, somebody online asked this, and it's very good. If you are attending by phone, please send us an email or contact us with your name and your phone number, so we can associate your name with that phone number as an attendee.
Yeah, good catch. All right, Ms. Kimball, you have a question or comment?
I do. Hi, Daryl. Glad to see you back.
Yeah, thank you.
I wanted to just say thank you for that online verification. Absolutely brilliant. That's the kind of computer information we can be using, and it really benefits everybody and does save the LPC and other professional money when you don't have to send in fees to different states and wait for letters and that they don't even send. So good catch on that one. And then the complainant, if they're uncooperative, that is so wonderful to hear that, because it feels like now we've got a board and an administration that's actually mutually beneficial, not just protecting the public, but protecting the professional as well. So I was really excited to hear that part. I wanted to hear a little bit more about this workforce shortage. I know I have spaces open, but I'm not really sure how to tap into the workforce shortage. So I would like to see the board and the administration informing us, like, how can we help? Where do you know, there's some of us that will adjust their fee to help people. And so I'd like to hear a little bit more about that to see if I fit the bill in any way. I also wanted to just make a comment about these tests. I think the SAT exam is a good model to follow. And when you guys do your big government contracts, that you have to have a CYA clause in there or some kind of copyright, that if the people are developing a test for you, you should have some ownership to it and not be able to be held hostage or have associations, and I don't care what association it is, managing the government or our profession. So those were some things I'd like to hear a little bit more about. And that's it.
Well, I can assure you, if we develop a test, it will be owned by us. We're not going to pay money and give it to somebody else.
Yeah, lesson learned, right? But I'd love
Yeah.
that you're catching this in one board, because this is going to have the trickle down effect. And it's just like
Yeah.
K-CREP requiring, oh, you have to have a doctorate to teach, and you have to have this and you have to have that. It's nonsense to let associations run, you know, a profession and the government. It's just wrong. So I'm glad you caught it. And I hope that, you know, you get your board together. But I thought of the SAT model where there's proxies and things like that that are employed through different schools or agencies. However, it's run by the government. So
Yeah.
anyway, just an idea. Thank you.
Thank you, ma'am. Ms. Galt, did you have a question or a comment? Cynthia? Cynthia, can you unmute yourself?
Thank you. Thank you. Yes. Can you hear me now?
Yes, ma'am. Loud and
Okay.
clear.
All the emails say no reply email. So I'm wondering, I attended by telephone and want to know, how do I get my CEU? Who do I notify of my telephone number?
If
well,
you're
don't
welcome
say
to
it.
email.
Go ahead,
I was saying, yeah. What I've told on the answer is, if you'll go to our Contact Us webpage and just send an email through that Contact Us. If you choose the
Okay, you're talking to
program-
somebody with no technical skills. I don't even know what the, I don't know what the
Oh,
Contact Us
that's
webpage.
why it's the easiest. If you just go to our main webpage, on the menu on the right at the bottom is just a Contact
What's the
Us.
main webpage?
bhec.texas.gov.
Texas.gov?
BHEC,
BHEC.
BH.
Oh, okay.
.texas.gov.
.texas.gov, and say it again. What do I do then?
On the menu on the right, I believe Sarah's showing this. There is a Contact Us. It just says Contact Us, and you just click on that. And that brings up a form, and you can just put all your information there.
Make sure you include Cynthia on your phone number, whatever phone number you called in from.
Yeah,
And that's-
I have a terrible feeling this is already over my head. I wish I could just tell somebody. This is okay. Go to BE. Is there a number I can
Well,
call when I
and-
start to run this up?
Well, and also you are appearing by name, so I don't think we need your phone number.
I registered online or through my email, but I participated through my phone.
But
Cynthia,
we
I
see-
found your license. I'm gonna send you an email and we'll get it all taken care of.
Thank you. Bless you. Bless you. appreciate that. Okay, that's my question. Thank you so much, you guys.
See, when you timely pay your renewal fees, that's the level of customer service you get, folks.
Wow.
So,
I love it. Thank you.
yeah, thank you, ma'am.
Bye-bye.
All right. Anybody else with a raised hand? Going once, going twice, because I'm about to move over to the phone. Okay. Mr. Davila? Daniel? Daniel, you with us? It looks like you're unmuted, but we can't hear you. All right. I'm going to put you back in the hopper till you can figure that out. I'm going to move to the next person. Jerry Ko?
Close enough. It's pronounced gal.
Oh, wow, I
Um,
missed that one.
No one pronounces it correctly. So I contacted the board staff through the phone number online, and I emailed regarding the same situation. Related to wanting to, I'm looking to go to a school that's out of state to do PhD work to move towards getting the LP.
Mhm.
And when I called the board and emailed the board, they told me the same thing, that they cannot tell me if they would accept a transcript from the school until I've graduated from the school. And so I asked them, partly maybe a little bit in a frustrated sense, that basically they're telling me to spend the 70, 80, 100,000 on the schooling, and then I'll find out if it's even permissible here in Texas. So what can we do about that?
What I would do is you can look at the school and see, if you're applying for anything under the psych board, you just have to graduate from a regionally accredited university. And what that means, it's got to be a university that's accredited by CHIA, one of the accrediting bodies that's approved
Okay.
by CHIA. And take a look at Board Rule 463.1, and that lays out that's the rule that says you got to have a degree that's been awarded or conferred by a university that's recognized by CHIA or the Higher Education Coordinating Board here in Texas, or the U.S. Department of Education.
Okay.
So as long as your school is accredited by one of those bodies, you're good to go. Now,
Okay.
now that's different from what your degree is in. So
Right.
you could have a degree from one of those accredited by one of those programs, but if you get a degree in basket weaving, that's not going to help you
Right.
over here. So
why couldn't they tell me that on the phone?
I don't know. That's a good question.
Yeah.
That's something.
Because that's happened to me several times. I've called the board, even when the stuff with Medicare, calling and asking, what can we do as an LPC to opt out? And they told me they had nothing to do with Medicare and I needed to talk to Medicare.
Well, that would be true on that one.
Right.
Yeah.
And Medicare was giving me the information that says, talk to my state board. So it was just, I was getting thrown back and forth, which I got that one worked out on my own. But it just seems like when we have questions, I don't know if other people have experienced this, that when we call, they don't even attempt to help us.
Yeah. Well, that's something I'll definitely visit with them about. That's one
Yeah.
of the things that Patrick's gonna choke me here in a minute because he's got something to say. But I'll tell you, one of the things that we're asking for from the legislature this go around is an ombudsman, which
Mhm.
is going to be designed to help for situations just like this, where maybe the reception staff are not going to be able to help you with that type. The receptionists, the folks that you're talking to in the reception, they're not going to be able to answer your question about
Uh-huh.
is this university, because they don't know these rules. They're not going to be able to help you. The L&Ps typically, they're typically working remotely most of the week. So, but when you do get a hold of them, they should be able to answer that question. So I'm going to visit with him about, do you remember, well, don't say who you talked to, because
I don't
I'm not
remember.
Okay, I'm not trying to burn anybody here, but
No, and I don't want to burn anybody. I just
Uh,
would like to, know that when I really can't find an answer, there's somewhere I can turn to.
yeah, yeah. Did you submit an email
Yeah,
and they didn't
Yeah.
answer it at all?
they told me the same thing, that they couldn't help me with that. So,
Okay, we're gonna look into that. Robert and I'll look into that. Patrick, what have you got?
Well, I was just gonna add that the answer to that question might be a little bit more complex though, because if she went to an accredited university and got a doctoral degree in psychology, it might allow her to get the provisional license. The bigger issue is I think she might be looking to see if she would qualify for the licensed psychologist license down the road. And the bigger issue that we get into is if the program that she's going to go to is an APA accredited program, then there shouldn't be a problem with the degree that you receive, getting licensed, and then you just have to do your postdoc hours to get the LP license. The bigger issue that we have is the internship, and some of the programs, if they're not APA accredited, they still have to comply with the 46311 rule about the internship requirements, and some of them do and some of them don't. And I think that's where staff really has a lot of heartburn of saying, well, this is going to be good or not good, because they don't know what the internship is going to be at that university that you go to, and if it's going to meet all the requirements of 46311. So that's really, and that's where we have a hard time saying staff oftentimes can't really pre-evaluate and know what you're going to do until you've actually done it and it's on your transcript. I think I don't know, maybe I'm crazy, but I think it's actually kind of a complex question. I think that that's why it's harder to answer it.
well, but even if they could say, these are the things that we have to make sure happen or something like that, to help me at least have some guidance.
Sure. Yeah, if you look at 46311 is the specific psychology rule, and I believe in subsection D, it talks about some of the specific internship requirements.
Right.
Now I wouldn't just look at D, but D is specific to the internship requirement, because some of the other provisions in that rule talk about ways you can meet some of the other supervised experience requirements. But that might help kind of guide you to help answer your question, I think.
Okay, thank you.
Thank you, ma'am. That kind of brings up, these calls. I don't want people thinking these calls are all for sunny questions. It's okay if you guys have hard questions for us, or if you just need to chew on me for a little bit, that's okay too. You can ask those questions. So guys, don't think that don't be scared to talk. If you got some gripe, that you want to let us know. Cause I mean, if we've got a problem somewhere, I'd rather find it out here than let it fester and become something even worse. So, just don't be scared to share those types of things with us, guys. All right, let's see if Mr. Davila is back online now. Daniel, you with us? I'm gonna see if I can help you try to request an unmute. Daniel, you with us? All right, going once, going twice. He stepped away to go get a Dr. Pepper, I bet. He's not even gonna bring me one either, so. Let's see. Nope, I don't want to remove him. Permission. There we go. All right, I'm going to start going down the callers here. So what I'm going to do now is I'm going to unmute the folks that are calling in my telephone. You can, if you're calling in my telephone, you can unmute yourself by hitting *6. So once I do it, you should hear a prompt that kind of tells you that, but *6 is what you use to unmute yourself. So caller ending in 7786. Have you got a question or a comment? Hearing none. I'm going to move on. Caller ending in 5952. Do you have a question or a comment? Hearing nothing. And then lastly, caller ending in 7910. Do you have a question or a comment? All right, hearing nothing. Oh, we're a talkative bunch. All right, so no other rate. Oh, all right. You made it you made it just under the wire, Ms. Webb.
No, sorry. I was like, let me just ask because I didn't see a response yet. I'm a social worker and I just had a question. I know we have different requirements for our CEUs for cultural competency, supervision, if we have that status. There was one particular cultural competency CEU that I was curious, and I reached out to the CEU provider and she just told me to reach out to our board, but I know it's difficult to get a hold of anyone just to see if it meets the Texas requirements. How will we know, like for any CEU, if it meets, the supervision or the Texas requirements, if it's not specifically listed?
Well, if it's from an approved provider,
Mhm.
I mean, it's a pretty loosey-goose standard. It just has to be directly related to the practice of social work. And that you'd really have to try to fall outside of that, I would think. Now, if you're in there just doing, yoga or something like that, that's not going to count. But
Right.
if it's, we're pretty liberal in our application of that rule being directly related to.
Okay.
So don't overthink it, is what I'm trying to tell you.
Okay.
And then of
Yeah.
course, if it's from an approved provider, you stand in even, I mean, it's going to be, you're just almost a shoe in if it's from, like NASW Texas, the national NASW group, or any of your local area societies, you're going to be okay there.
Okay. Yeah, this one was like a thing, Cultural Health. It's an online provider. I'm not sure what group it falls under, but I had some other ones. I was like, well, if I have to, I'll go through the other ones. But I know there were some supervision ones, like where it says like you'll get CEUs, but it doesn't say, necessary state like supervision CEUs for
Mhm.
Texas. So but it talks about supervision and like, the models and whatnot. So that's why I was just curious. I don't want to.
Yeah. We don't have the manpower to approve all CEU courses. So we really, that's why we say we don't pre-approve them. If you call us and say, was this going to count? We're going to be like, we don't do that.
Okay.
We can't tell you. But what I can tell you is that we're very liberal in our application of those rules, because there is just a vast spectrum of CEU programs out there that are acceptable and that meet the rule requirements.
Okay, so there's not like for a CE provider, they don't have to meet like certain requirements, or there's not like a guideline that, oh, we have to talk about this, and this statute for Texas.
No,
Okay.
we don't have anything like that in there.
Okay, great.
I can't remember what y'all's CE rule is in social work off the top of my head, but what I would say is just read that rule. And people read it and they overthink it. I'm like, don't overthink things. Just read it. Just give it a fair reading. Don't get hyper technical in its application, and you'll be okay.
Okay, so it's a supervision CEU that has supervision in the title should more than likely qualify for supervision.
Yeah.
Okay.
I think you're going to be safe.
All right, I appreciate your time. Thank you so
You bet.
much.
You bet.
And Daryl, can I just, since we are hitting on past
Yeah.
time, confirm with you for those still listening, if you have attended 50 minutes or more, you will get credit even if you have to go now.
Yes.
You're not required to stay till the bitter end.
No.
So if you have things to do and you've stayed 50 minutes, you will get credit even if you have to leave. That is okay.
Yes. Yeah. You don't have to
I have a
sit
quick
through.
question.
Yes, ma'am.
So if I completed my supervision hours for LCSW in 2018 and registered those hours with the state board, how can I just apply again to take the test? With that, I mean, how is there no limitation on how many times you can take the test and how old my hours are?
Sarah or Patrick?
So, Ms. Hudson, there's no shelf life for your supervised experience. Those rules were repealed. If you are ready to attempt the clinical exam, then you go to the Social Work Board's webpage, ASWB licensure examinations, and you click on the link for the Texas specific exam registration process.
Okay. That sounds good. And you can take the test as many times as you need to?
Yes, they're, because ASWB does all of the pre-exam approvals, the rule that requires a study plan after 3 attempts, that no longer applies to the ASWB exams.
Great. Thank you so much for your time.
You're welcome.
All right, Mr. Carr, do you have a question or comment?
Yes, I'm Dr. Joel Carr. I run the doctoral program at Angelo State University in clinical social work, and we offer a clinical supervision course as a part of our curriculum. And that course is built around the board rules surrounding the content required in a clinical supervision training course. The only deviation from that is that it states in the rules that it has to be completed within 90 days, and a academic semester of 16 weeks exceeds 90 days. So what I did is I have all the content occurring in the first 90 days, issue a certificate, and then continue with the course on their other content. Would that be acceptable, or am I off base, or do I need to modify my thinking?
Let me ask you this a short way. Have we accepted it before?
No, our program's fairly new and we're graduating our first students. I think one young lady did submit it, but she's in that process, and I think it's way early for her to get a response from you guys.
Okay. So they complete all the coursework.
Yes.
Within the 90 days.
Yes.
And then
we continue with the course, because there's this 90-day clause in there, and I am an LCSWS, and so I meet, all the criteria of an instructor, and
yeah,
of course we're an accredited university and so forth, and so it's just thought I'd ask.
Daryl, does the 90 days apply for it coming from a if it's an actual course, then that's acceptable?
Okay. Great, it is.
I was just looking at the rule, and unlike marriage and family therapy, which allows someone to take a graduate level supervision course.
That's right.
I don't see that in the social work rules.
That's right. That's why I'm asking that question.
Yeah, so
looks like we need to look into it.
we'll have to, yeah.
I
Let Tim say.
appreciate it.
We'll look into it. Thank you, Mr. Carr.
All right, y'all take care.
Thanks, Doc. All right. That looks like it. Somebody was asking in the questions, do we post the Q&A after the meeting? No, we don't. We don't post those anywhere. Alfonso says the meeting has been more than adequate, Tim. That was inside joke, sorry. All right, that is all I have, unless anybody else has anything. I think we have bored these poor folks enough. They have endured more than their fair share to earn 1 hour of continuing education. Number one, thanks everybody for attending and hanging in there with us. I know that sometimes this can be tedious to listen to all this, and we're not always the most entertaining, but we do appreciate the feedback that we get. And I got to tell you, this is actually one of the more enjoyable parts of my job, is getting to do these types of things with y'all. I actually like this. Now I get to go back to dealing with the folks I don't want to deal with all the time. So, and I'm not talking about my staff. So none of my staff, don't beat me to death after this is over with. But anyway, I appreciate all y'all hanging in there, and I will try to get the email with the continuing education out to you. I'll try to do it today. So make sure you get us marked as a safe sender in your email program. Remember, at bhec.texas.gov. Make sure that's in there so that it gets to you. That way I get as few emails of, I didn't get it. Then I have to figure out whether you actually attended 50 minutes or not. It's just, anyway. And don't email me if you were here for 48 minutes and you just want me to look the other way. We're pretty generous as it is. Just, you should have been here for 2 more minutes. But anyway. All right. Thank you all very much. Hope you have a good rest of your day.